Hi, my name is Tom, and I'm here to talk to you about acromegaly. Do you know what it is? Acromegaly is a rare endocrine disorder linked to an excessive growth hormone that affects about 70,000 people worldwide. Who is affected and why? Acromegaly affects men and women equally, occurring most frequently as they reach middle age, their late 30s, early 40s. It is very rare. Only 2 to 11 new cases per million people are diagnosed each year. The name acromegaly comes from the Greek akros, which means extremity, and megalos, meaning large. Although the first case was recorded in 1567, the disease remains rare and unknown. There have been famous sufferers throughout history, all presenting with the same clinical characteristics: excessive growth. What causes acromegaly? In acromegaly, the pituitary, a small gland at the base of the brain, produces too much growth hormone, usually because of a benign tumor, also called a pituitary adenoma. What happens when there is too much growth hormone? An excess of growth hormone has both direct and indirect effects on a large majority of organs and tissues in the body, with long-term impacts on overall health. Physical changes include growth of the hands and feet, which become larger and swollen, as do the lips and tongue, nose, while the brow and lower jaw protrude. If you find your rings are too tight or shoe size increases, think acromegaly and consult a doctor. However, these symptoms are very slow to appear and progress over several years, so that often family and friends don't notice the changes. For many patients, their early symptoms are not visible and may include headaches, vision problems, chronic tiredness, joint pain, dental pain, arthritis, and poor sleep. As these are non-specific and occur in many other illnesses, it makes diagnosis difficult, which means many fruitless visits to different doctors and specialists, including dentists, ophthalmologists, rheumatologists, who don't think of this as acromegaly, so patients may begin to think they are imagining their illness and feel misunderstood.
Do you know what the doctors told me? That it was all in my head and I should see a psychologist.
People with acromegaly find the tiredness and pain they suffer, along with the changed appearance, impact severely on their lives and the way they feel. Without a diagnosis, it can be very difficult to find people who understand how they are feeling. Unfortunately, it's common for many years to pass, sometimes more than 10, before the correct diagnosis is given. What happens once acromegaly is diagnosed? Personalized treatment can be initiated to control their disease and improve symptoms, so that patients can experience a better quality of life while living with acromegaly. Talking about acromegaly to increase awareness.